So today what I wanted to talk to you about was strategies for coping and healing during and after spinal CSF leak. So I'm a family doc and a public health physician, and I started getting headaches in about 2016, treated myself for about 6 months, thought it was sinusitis, et cetera, et cetera. So I also have lived experience with a spinal CSF leak for about 4 years. I have no conflicts of interest. I'm a volunteer member for the board, their medical advisory committee, their scientific advisory committee, whatever Bahari asks me to do. So today what I wanted to talk to you guys about was I want to discuss the gap that's created in our lives by illness and discuss, frankly, some of the feelings that are associated with that experience. Look at practical ways of coping and healing both during and after illness, because I think that healing is really important also during illness, and discuss ways of bridging the gap that, and how you make yourself back to you. So I've always tried to practice by, and this has always been up in my wall as a physician, that WHO definition is that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so we all basically, everyone in this room wants to be a healthy, happy, whole human being, right? And we know that SIH has profound impact on all aspects of health: mental health, physical health, social, and financial health. Right? And there's the recent Canadian study, the UK study of the year before, and even Farna has brought up a few other countries who've also made that same point. So it's really all across the globe. It's because it's such a debilitating illness, and I know I don't need to tell you guys that. So the work of coping and even healing begins during illness, and nor are we suddenly cured, once we have the leak patched, if you like, and that work of healing and recovery continues after illness. So illness can leave you feeling really stranded and isolated, right? The gap yawns out large and loud before you and behind you. And lots of times people feel really lost because, you're not who you used to be with a busy, active life with a day full of activities, and you have no idea of who you're going to become without an active treatment plan. So I'm going to tap on my experience today because I believe illness is a teacher. And I have learned lots from the physician's chair, what I was taught, and what patients have taught me in watching them through their own struggles of crisis and illness in their lives. And then I'm going to tell you what I learned from the patient's bed. So twice in my life, I've had 2 major illnesses. And so I'm not much of a sharer, but at 35, I had breast cancer, and then at 53, I had a spinal CSF leak. And so both of those illnesses taught me, in different ways, right? So as I said, illness impacts our sense of ourself as a healthy person, impacts our sense of control. Like I think in some point in life we all realize we don't have as much control on our lives as we thought we did when we were 19, but it can make us feel a fool. I know for me, after my breast cancer diagnosis, I just couldn't look at old pictures where I was laughing and joking and swinging my kids around. I just thought, what an idiot you were. Like you had no idea what was coming. That was a weird but overwhelming feeling. And it can impact our trust and confidence in our bodies that we may feel that really have betrayed us, right? And leaves us feeling isolated. And during illness also, your mind's eye can be open to past traumas and injustices just at a time when you really have no capacity to deal with it. And, it leads to a fear of falling ill again and that, dread of recurrence. So we have to learn to live with being sick. Like, who am I now while I'm sick? I'm no longer that healthy person I used to be. And for me, I know a line was kind of drawn in the sands of my life, and it split my life in 2. There was before cancer and after cancer. My cousin, similar to me, she was in her early 40s. She had a baby like I had, 2 little children, and she developed breast cancer. So I hopped on a plane. I flew over to see her, and her husband picked me up at the airport. And he said to me, Rosann, we're treating this like this is just a bump. It's just a fever. Everything is going to go back to normal. And I didn't know where to start to tell him nothing was ever going to be quite the same again, and that he really had to find a way to acknowledge that if he was able to validate his wife. So, you know, you have these feelings of isolation from your social group. I know for me, having breast cancer at 35, like, there was my gang. We'd gone to elementary school together. We'd all kind of gotten married around the same time. We'd had babies around the same time. And suddenly I felt outside that group. I didn't have a group anymore because I couldn't talk to my friends. I did not want my friends living my life. I did not want my friends putting an 8-month-old to bed thinking, I mightn't see her start school. So I had no one to talk to. So you have that experiential isolation from that. This is why I don't talk about it, sorry guys. But, and sometimes during illness, right, we feel let down by people who could not or would not support us. So, and then I found, you know, when one of my biggest struggles was the year after, right? Because, you know, everything's back to normal. Your, you know, chemo's done, you're finished with the doctor, surgery's over, you've recovered, you're back to full-time work, you're back to full-time mom. And I go to the grocery store and I just feel overwhelmed. I think, what do I do now? Like, what do I buy? What do I eat? How do I keep this from coming back, right? So I had to learn to live with the knowledge of what it was like to be sick. And I had to, and I found in the parallel when I had SIH, I had to learn to live with the knowledge of what it is like to be so disabled and not able to stand up. So how do we integrate that knowledge in a positive way? And I think, you know, and I'd often say that to my patients when they're going through a really rough time, nobody escapes it. You know, everybody has at times in their life when the shit hits the fan, if you like. And I do swear in front of my patients, yes. And, but, you know, there are ways, like illness is a teacher, there's ways to integrate all those experiences in a positive way. So I do believe that having had two quite different illnesses, but major illnesses, that SIH has some nasty and unique features, right? And, you know, headache isn't a visible thing, right? And it's not like a cast on a limb, nor is it like the diagnosis I had of cancer, right? People may think they get it because everybody's had a bad headache, right? There's a long time without a diagnosis. Most all of us have experienced that. So you're fatigued, but the people around you, your caregivers, are also fatigued, right? And there's a misdiagnosis, which is such a common aspect of a spinal CSF leak, may lead people in your life who you thought you could rely on say, you know, what do you know, it might be your mother-in-law saying, you know, you're just depressed, darling, you just need to get up, right? So you have on top of it that experiential isolation. You now have a social isolation because we need to be recumbent just to control our pain and get through our days. So, and also we have many visits to the doctor, and you know, I had many visits to the doctor with my breast cancer, this doctor, that doctor, but none of those doctors said, what do you think we should do next, right? It's a totally different experience. And so sometimes you go into a doctor and you're not being validated at all because they don't know what to do with you, right? They haven't heard about the illness or et cetera, et cetera. And, you know, self-advocacy is an important part of illness, but our self-advocacy is limited by pain, the need to, you know, brain fog, and the need to lie down. And it can shift your relationship with your physician because as physicians, we're really uncomfortable when we don't know what you have because you want us to tell you and we want to tell you. So that shifts your relationship sometimes with your physician. So this is what I've always told, sorry for my not very fancy graphics. I couldn't get my daughter to help me. So from the physician's chair, I've always taught people that, you know, the triad of social support, just as we feel the need to withdraw, physical activity, just as we feel we don't have the energy, you know, to do anything, and religion, or what I call whatever feeds your soul, are important things to tap into, just as we feel disconnected. So we know that social supports impact our health and longevity, even when we're well. And some patients will really struggle with, you know, who do I choose? And I often say to people, there's other resources available beyond family and friends. I know it's easy because it's not easy, you know, because it almost becomes like the work of being unwell. And that pain and fatigue are often significant barriers. And I always remind people, it's not your fault if you're not getting the support that you need. So this is adapted from a resource that I've used over the years. And I'll tell people, draw themselves out a circle, right? Put everything you can think of in that circle. within that circle, put the people down, and then stir them. Find your champions, right? So, you know, we often think of family and friends, but for counseling, there's group counseling, individual counseling. I know for me, you know, an unexpected source of support became my child's grade 1 teacher when she overheard him saying to me, "You look ugly bald." And so she took him out of music class the next day, and she you know, sat with him for that while all the other kids went off, and they wrote a list of why it was cool not to have any hair. So, you know, and when I reached out to her to thank her for that, you know, she became a support for my child and therefore a champion for me. So always look for those people. In the rec center, you know, I wanted to keep physical. As a physician, I knew the longer I was lying down, these legs weren't going to last long. They were scrawny anyway, so I was going to lose my muscle mass. So I went to the community center. I walked against the lazy river so that at least I was engaging my muscles, and I gauged it by headache. Right? You know, we all know about the online SIH sites, you know, the Facebook groups. I also used Inspire, which is a Facebook group, you know, a community that's on rare illnesses, even though SIH is not rare, but we were in there. So, and you know, think about your workplace, work colleagues, your employer, you know, your faith community if you are religious, your minister, and then social and hobby clubs. You know, while I was sick, I learned to play the ukulele. Not well, but I went, and so I encourage people, like, this is important, right? And not easy. It was not easy. Some nights I couldn't go. Sometimes I lay down. But I still try to keep those connections because they're so important to heal yourself while you're ill. And unfortunately, the only one that can heal you sometimes is you. That's the hardest part, right? And then your doctor. So I've often told my patients who have chronic illnesses, you know, book an appointment with me on your way out so we have a regular connection. You know, I say that to my patients. I didn't do it myself. And at one point when I really had hit a wall and was in a desperate place and finally went to see my GP, and she said, "Where you been? Like, why haven't you been here? Why haven't you used me?" So do that. And I've learned over time to take the advice I've given. So, you know, I always say to people when they say, you know, I don't know who to reach out to, I say, you know, that's often the person who, if you heard they were ill and they hadn't reached out to you, you'd say, "Geez, why didn't you tell me?" So there's that person. And then, you know, it's important to look at the people. Do they believe me? Do they validate me? Are they concerned about my emotional and physical health? And are they dependable? And then I tell people, put a star beside your champions. Find your champions, right? And then, you know, I've talked to lots of women with spinal CSF leaks over the years, and I've talked to lots of women with breast cancer over the years. And, you know, I often hear their grief and their anger at somebody who just wasn't there for them. And I say, and I love Brené Brown, so I say, you know, she stole this from somebody else, but she popularized it. And I say, you know what? Don't focus your energy there. Focus your energy on your stars. Don't try and win over the haters. You're not the jackass whisperer. So religion. So to me, religion is whatever feeds your soul. You know, I'm more on the line of music, I can't knit, but, you know, reading, knitting, drawing, puzzles, right? So I'll often tell people, you know, keep a list on your phone. So when the day is crap, it's there. So my list was called things that soothe and things that I love. And I get people to rank things, so your top things are up there. But I also tell them, move it around. If it doesn't work one time, put it at the bottom of your list, but don't be afraid to use it again a couple of weeks later. So physical activity, you know, this is a big key for me because as a physician, I'm always trying to get people active. And I perhaps have a little ADD, so I have to keep moving. But it's really important in our overall health, including our mental health. It also gives you back that connection with your body that you lose during illness. And we all know you get muscular and cardiovascular deconditioning with the amount of lying we might do down over the years. And then that, you get a vicious cycle where therefore you can't tolerate being upright. The Canadian guidelines are 150 minutes of moderate to vigorous physical activity a week, and then twice a week for some kind of strength training. But we know that short sessions of 10 minutes or more count. And of course, I know none of us were going to get up to that mark, right? But everything counts. So how do you do it? You get advice from your physiotherapy or your doctor. I use lying down in order to get up. And you know, during illness and after illness are completely different journeys, but the rules are the same. You start low, go slow, 10 minutes count, walking works. Find what works for you. I found expertise at the rehab center, not with the first physio I saw. You know, she literally threw up her hands and said, "I don't know what to do with you." And I could sense her mounting frustration in not knowing, you know, her attitude was, I've never seen a leak, so what do I do with you? And finally, one day when she said to me, don't come back for 2 weeks, not see you in 2 weeks or good luck for 2 weeks. She said, don't come back for 2 weeks. I just gave up and never went back. Right? So, but then I got my act together. I went to see my doctor and I said, can you send me again, but just put not Mary Smith. Of course, that's not her name. But so that's what I did. And then I did find somebody somebody who treated me like a concussion case. So they, I could be active and to a certain heart rate, not to get headaches. So, I'm not going to get really into the physical activity during, while we're sick, but, walking works, pool running, the lazy river, recumbent bike, and get advice, right? And give feedback. If something doesn't work, let your physiotherapist know. And of course, I'm sure your kitchen probably looked like this: no bending, no lifting, no twisting. So that's after the epidural blood patch. And I say to people, follow your specialist advice. That's not my area, right? That's your specialist area. And remember, reconditioning takes time. So what did I learn from the patient's bed? So I learned about self-care. Wasn't so good about that. I had Irish mother, but I learned self-care is important. Self-compassion is really important. And how to modulate my sleep when we're lying around so much. So I used, these are just some of my tricks I'm giving you. These may not work for you. This is a personal talk in many ways, but I use visualizations because I'd used it before in sports. So because I was young, everyone thought I didn't have a breast cancer and it was just a lump. And so the surgeon cut into it. He cut into it with a knife, and then realized it was cancer and closed me up again. So while I was waiting to go to the big city to be seen, I was terrified as a physician that he had now, my body had walled this thing off, and he just opened it up and was letting these cells, go in my blood system to my brain, my kidneys, my heart, whatever. So every morning I would lie there and I put a barrier between my breast and the rest of my body. And during my CSF leak, I used a golden light. That's how every night before I went to bed, and I would envision a golden light that was coming down, circling my brain and healing it and running down the level of my spine. No scientific evidence whatsoever, just made me feel better. And it made me feel like I had some control in an out-of-control situation. So meditation, I learned to meditate through the Oprah and Deepak Chopra free meditation thing, but mainly self-care. Meditation became a me time when my kids, Mom, I never answered. They knew when I had my headphones on, Mom, wasn't going to work. I used journaling. And for me, this was the biggest one for me. I used the 5 senses. And, so if I was out on a walk, I would think, 5 things I could smell, 5 things I could see, 5 things I could touch. So all my senses. And for me, that helped me to ground myself in this moment, and I call it, the next cycle, the worry of the next appointment, the next intervention, the next test. So, and I use that all the time at bedtime for sleep. So these are, I'm not going to get into this because my slides will be available. These are some of the things, some of the books I use, some of the things that I learned, and this is Kristen Neff was the psychologist I saw at the rehab center, told me all about Kristen Neff. And so this is the star of the things that I believe really can support both during and after illness. And finding your way back to you. So the team that you have to rebuild may look quite different from the team that took care of you while you're ill, if it was a neurosurgeon, et cetera. And, use your family doctors. Don't be a Rosann. Use your family doctor. Stay connected. Make that appointment when you're leaving the office so you're not, calling in a desperate need of an appointment and don't have one. Moving forward is not easy. I know that, I hung out and did yoga with a bunch of 70 and 80-year-olds when I first moved back to Newfoundland. And I love these women. I just love these women. And that was a huge loss, was that community to me. So I tried to go back to yoga, but, every downward dog made my head feel like it was going to, pop off. So, and I remember really lamenting that I couldn't do yoga in the way, and I was afraid to do yoga in the way I had before. And one of the other girls in class who was, she's the class yacker, one day she was talking about something that happened in her own life. She was a really cool chick. And she said, she said to herself, don't look back. You're not going that way. And so that quote really helped me. I thought, okay, you're not going back. You didn't go back after cancer. You're a new person, and you're going to have to accept that. So, I think it's that challenge to redefine ourselves with the knowledge gained, stuff we never wanted to know, but you know it now, and it's how you integrate it in a positive way. And I liked mindfulness when they, talked a lot about the Japanese art of kintsugi, where gold lacquer, you smash a vase, we throw it out. They smash something, and they fix it back together with a gold lacquer, and they revel in the fact that that object is stronger and can be more beautiful when it comes back from breakage and repair. So physical activity was key for me, may not be for you, and that gave me a sense of some control and reconnection with my body, because I really felt my body had betrayed me now multiple times. And it regained confidence, my confidence in listening to my body. I had a really cool physiotherapist who told me to ignore my mind, that, I started kayaking. I had paddled always, but I kayaked, and, my brain would go crazy saying, what are you doing, what are you doing, what are you doing? We can't do this, right? So start low, I went slow, and I had, when I first was ill, I used to walk this small pond near my, it's an 11-minute walk. It would take me 40 minutes with my father, my 89-year-old father, and I stopped at every bench. So I went back to that small pond to walk after I was well, and my father was really glad we didn't have to sit down at every bench. And I tracked my progress, and I sought advice. So, and then last year, in this whole rebuilding, so twice I've had to sort of rebuild myself. I felt sort of from scratch. And when I left the hospital when I had breast cancer, and the nurse said to me, don't lift anything heavier than a dinner plate. And at home, I had an 8-month-old, a 2-year-old, and a 5-year-old. So what a ridiculous thing to say to somebody in that situation. And so we were all taught, because of the type of surgery I had, that upper arm activity was kind of verboten. So, and there was a rehab physician out in the West Coast who said, this is crazy. I don't want to be telling all these young women, no tennis, no this, no that. So he took a bunch of breast cancer survivors, he stuck them in a dragon boat, and he made them paddle all summer. And he found, if anything, lymphedema was improved, and then it prevented other women from getting lymphedema. So I became an avid dragon boat paddler. That's me in the fog in St. John's in 6 o'clock in the morning. And then, so I had rebuilt after that, and physical activity was a big, important part of my rehab. And then last year, as I'm kind of back on my bike, I'm back in a pool, I'm back at yoga. I'm not doing the same twisty stuff because I'm too afraid as I did before, but I'm back at a lot of stuff. And a CSF leak expert who I truly admire and still do said to me, no, you shouldn't be doing any of that. And I was so taken aback, and I thought, well, who am I without this stuff, and I didn't want that who I am is ill. So I was just like, I've been working so hard. So I said, somebody else who I admired, I said to him, this is what I've been told. And he looked at me and he said, Rosann, you're a couple of years out, and your risk of recurrence is probably low. So he said, we don't fix you, so you live life bubble wrapped. So what did I do? I was flattened really by this comment, right? So I decided I had to take the advice I've been given to people for years, and because I see so many people crippled by illness, and they can't find themselves their way back to themselves. And I'd always say, you know what? You can get used to living life at half-mast, but that doesn't mean you have to. So I had to take my own goddamn advice. And then I'd had some other incredible advice that I'd shared with many people during my career. At my last clinic appointment in the cancer clinic in Halifax with the oncologist, he looked at me and he said, any last thing you need from me? And I said, yep, I need you to tell me I'm cured. And he said, well, Rosann, I can't, but I can tell you, you have to live life as if you are. And he also gave me a really cool analogy that I've stolen and used, with breast cancer survivors that sometimes call me, and SIH, and my own patients, that, how do you learn to live with it? How do you learn to integrate those things in your life? And he said to me, Rosann, eventually you'll put that all in the box. All that grief, all that loss, all that fear, you'll package it up and you'll put it up on a high shelf. And he said, first ache or pain, you'll haul it down, you'll open it up, you'll feel it all again. And he said, but then you'll pack up that box again and you'll put it back up on the shelf. And he said, then over time, what you find, because time is also a great healer, you'll take it down less and less. So really, it all depends on your outlook on life, right? And who you want and need to be, and how you put that box back up on the shelf. So I wish you all strength and support, and the very best of luck on your journey. Thanks.